The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified healthcare provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk. Welcome to the Birth Baby Podcast. Each week, you'll find guidance, encouragement, and practical tools to support you through pregnancy, birth, and the postpartum journey. I'm your host, Ciarra Morgan, a certified birth and postpartum doula, hypnobirthing educator, and pediatric sleep consultant. I'm also the owner of a doula agency in Austin, Texas, and the founder of the Birth Baby Academy, where I offer classes for both parents and birth professionals. Thanks for being here. Hello, everyone. Today, I jokingly, our resident midwife, I love to call you that, Leonora Colen is here to join me, and we're going to talk about something that is a little bit being talked about quite in a lot of mom spaces and parent spaces and birth worker spaces, which is free birth. So thank you for being here with me today and tackling this topic that can be a little bit controversial, but that's not why we're here.
Yeah, we're just here to present some information so that, if you or somebody you know are thinking about free birthing, you have all of the information that you need to make an informed choice.
Yeah, and just kind of bring awareness to some things that I think that a lot of people aren't thinking about. So I appreciate you coming and wanting to tackle this topic. And I think that it's something that a lot of people steer clear of because they're afraid of what people will think. So let's just dive in.
We should start with, what does free birth mean? Like, what's the definition of a free birth? Because, you can birth in a hospital with doctors, you can birth at a freestanding birth center or at home with midwives. A free birth is a birth at home that it has no medical attendance, has nobody, with a license or even, a training in how to deal with medical emergencies.
And I will say you can still have a free birth with a doula because we are not medical professionals. So some people that have a free birth do ask for like a birth attendant in the space of like a birth keeper or a birth doula or a companion to join them. And some people, I think this is important to clear up too, because I think some people think if somebody has a free birth, they're automatically having a wild pregnancy, or if somebody has a wild pregnancy, they're automatically having a free birth. So what a wild pregnancy means is someone that has their entire pregnancy, they don't get any medical care. They don't do ultrasounds. They don't see somebody for those regular checkups that somebody, quote unquote, normally would. So not everybody who chooses one does the other.
Blood work or, anything to check in. They just go off of vibes.
Yep. Intuition.
And the other thing to specify is that not everybody who winds up having a free birth planned for a free birth.
That's very true. Sometimes babies decide.
Sometimes babies decide that their parents are going to have a free birth. And what usually winds up happening in that case, more typically, it's not going to be a first-time mom. It's going to be somebody who's already had a vaginal delivery, and they are either planning to birth at the hospital, at the birth center, at home, and usually their waters break and suddenly it goes from 0 to 60 and mom is pushing out the baby on the toilet, in the tub, in the bed, wherever they are, on the way to the car, in the car. And there's nobody there. Ideally, hopefully their partner is there. And then usually what happens for those unplanned free births is that they wind up going to the hospital or the birth center, or the midwife comes to them and they get all of that like after birth, postpartum care, help with the placenta and breastfeeding and bleeding and all that good stuff with some attendance.
Yes.
So we've defined free birth. Let's talk about where this idea came from, because I think that there is an idea that free birth is kind of like the natural progression of like, if hospitals up here and birth centers there and home birth with a midwife is here, free birth is this like natural progression to the least possible intervention and the most like natural, back to nature, organic way. I do think it's important to recognize that historically, almost without fail through the ages, like back to like biblical times.
I was going to say, even in the Bible, yes. Even for Jesus's birth, there was a midwife, or people say that they think there was a midwife.
Yeah, most women choose to find somebody, a midwife, an auntie, somebody who has attended births and has experience in that realm. Most people feel safer with some level of, of somebody helping them, being around them, not being alone. So I don't think that it's necessarily like a natural progression. I think of it kind of as its own thing.
Mm-hmm. I agree.
Where did free birth come from? Where did this come from if it's not kind of a historical impetus or something that, people have necessarily been gravitating towards for a long time? It came from the Free Birth Society, which came to be in the 20-teens. It is a movement pioneered by Emily Saldana and what is her name? Yolandi Norris Clark. Both of those gals were doulas. And I believe Yolandi was having free births, and that was something that was working out well for her. And she was starting to attend births kind of in that capacity. And Emily Saldana was really interested in it and wanted to free birth, but had her first in the hospital. Her second, she tried to free birth, wound up going to the hospital for some intervention, coming back home and having the baby at home. And her third, we'll get into that later. They met up and they started talking about creating kind of a space for women, also monetizing the idea of free birth, I think was present from the very beginning. This is something that immediately took off massive popularity. They started doing their podcasts, they started doing videos. Their YouTube channel has like 25 million views. It started to become very popular. And I think that they realized that that was something that they could, monetize.
Yeah. A lot of people are searching for this information, and maybe it wasn't as popularized, or like, somebody, maybe they don't feel like they fit into the realms of everything else they're seeing. And then they see this new thing and it's bright and shiny and they're like, okay, give it to me. People want that information.
And there was a voracious appetite for especially their podcast episodes. I think that was like a real entry point for a lot of women, and how they were able to digest that information and get really into it and excited about it. So the progression was the podcast, the videos, a Facebook group. And then what happened was when it became super popular so quickly, they decided to put the chats behind a paywall. And then they also created the MMI, which was a midwifery, they called it a midwifery training program, but they referred to themselves as, and I'm putting this in quotation marks, authentic midwives. So that's not a lay midwife. That's not a licensed midwife. That's certainly not a certified nurse midwife. That is a term that they coined, authentic midwifery. And I think it's important to note that there was not a lot of actual midwifery concepts behind like what their training program entailed.
And even a lay midwife who doesn't have, the formal schooling training. So so for people listening who have no idea about levels of midwives, it's CPM. You mentioned lay midwives, you mentioned licensed, or like a CPM, right? A certified professional midwife, and then a certified nurse midwife. So those ones, the last two that I said have a formal training, but the first one does have kind of a generation to generation passed down, right? Is that?
Absolutely.
But yeah, so authentic midwives is even outside of this.
And traditional midwifery, has been pushed off to the side and is a very vibrant, incredible tradition, that is somewhat being lost because of it being marginalized.
And the regulations kind of don't allow them to, they could get sued because of doing that if they're not actually carrying a license.
Exactly. That's a whole different podcast.
I just wanted to put though in there that these are different layers and different dynamics of the same people using the word midwife.
Yeah. So I feel like we have defined free birth. We've talked a little bit about the Free Birth Society, how it came to be, what its trajectory looked like. I want to circle back and talk about why we are talking about free birth today. I wanted to be explicitly clear that I do not have judgment for how and where and with whom people to choose to have their babies. I think there are a myriad of reasons that people choose to birth where and with whom, and they are all valid. I had a home birth when I had my first child, and in some places, home birth isn't considered safe for a first-time mom, or not considered safe, but it's not available because they think that first-time moms are so risky that they should be in the hospital when they have their babies.
Have a proven pelvis first,
Exactly. I don't happen to agree with that. And I would say that my, 15-year-long career would bear that out. But I'm just saying that my choice, while it seemed abundantly safe and, appealing to me, might seem somewhat cuckoo to other people to go into labor and have your midwife and your doula and your husband attend to you, without electronic fetal monitors and without an OR down the hall. That felt good to me though. And that worked for me. And I think that for some people, there are reasons that draw them to free birth that we cannot discount. And I kind of want to talk about that.
Yeah, I think we should.
So I think that one huge reason that free birth has had the traction that it has is that we, as women, as birthing people, are becoming traumatized by the medical model.
Yep.
I love the hospitals here in Austin. I love being able to have access to St. David's and the incredible physicians and midwives and practitioners who work there. I am endlessly grateful for the care that they offer their clients or our clients. And I think that they do a great job by and large. But as a midwife, I talk to people when they come to us and they're interested in having a home birth with midwives. I talk to them about their birth stories. And it is 2025, and I am still hearing about horrible obstetric violence every single month of my life.
I'm seeing it. Yeah. I'm seeing it in the hospital as a doula and from doulas on my team that are going to births. We see it.
Yeah, I think it's worse for y'all because I think that when we as midwives attend to our clients at the hospital, there is a factor of people having to kind of be on their best behavior around us because they know that we're going to say something and step in even more so than a doula might do. Yeah, it's upsetting to hear. I mean, I spoke with a mom a few weeks ago who told me with her first birth that she was held down on and forced to be on her back when she had been pushing out her baby in a standing position beautifully with no difficulties. Also, they had been ignoring her for the hours leading up to that moment. They just came in and did that.
Well, and not to go too far here, but even as a doula, some of us doulas don't take births with clients at certain hospitals or with certain providers, even at a hospital that we love. And so if we as birth workers are doing that because of what we're seeing, and we're not even the ones giving birth, that response in mothers and people that are giving birth in hospitals are experiencing it within their own bodies and then running far away, or hearing stories from their friends and running far away because that's what could happen to their body.
Yeah, it's not a myth, sadly, that these things happen. And while they are more likely to happen in the hospital, they also sometimes happen with midwives at home or at birth centers. I do also hear stories about similar situations, people being put into positions that they don't want to be in and being
yelling no when they're having a cervical check and asking to stop and it not stopping. I just had a doula have this happen at a birthing center.
Oh my goodness. Yeah. Non-consensual internal exams, membrane sweeps. There are certain things that, when I'm in a labor, I kind of need to do. I kind of need to listen to baby's heart tones. I'm always going to tell you before I do it if I can. If you swap my hand away, I'm not going to be worried about it. I'm just going to say, okay, I'm going to come back a second later. I need to listen through this contraction. Other than that, though, pretty much every single thing other than emergency medicine, we are really going to be discussing and getting consent. Really at the cornerstone of all of our care is that informed consent. So I want to say that birth trauma is real. Birth trauma is still happening, and it can happen in the hospital. It can happen at a birth center. It can happen at home with a midwife.
Yep.
So I hear and see and recognize that. I also think that people have this idea that midwives are a tool of the state. I'm putting that in quotation marks. I see the fact that I am licensed by the state of Texas actually as a benefit to my clients for a few different reasons. One is that if I were to, God forbid, non-consensually do an internal exam or a membrane sweep or do something during your pregnancy or your birth or your postpartum time that you felt was not what I had told you I would do as a midwife, not what you expected, not legal, God forbid, you have an apparatus that you can appeal to that will take me to task, that will either find me or, tell me that I need to be having a more experienced midwife attend births with me for a period of time, or do more continuing education, or take away my license or, suspend my license. There are, things that can happen that will really immediately impact my ability to practice as a midwife. And for me as a client, I want to know that that's the case. I want to know that I have, something that I can do if things go wrong. I do see that as a positive. But also, as a licensed midwife, I am legally obligated to file birth and death certificates and, offer testing for communicable diseases and provide emergency first aid in case of, baby needing extra help with breathing or your postpartum bleeding. Those are things that I'm obligated to do and I'm happy to do. So I think that people, they have the trauma or the fear of trauma. And then they have this idea that somehow I'm going to be putting their baby in the system and making them, part of the deep state or whatever,
This is interesting though, because like you said, you need to check the heart tones, right? And now if somebody says, I don't consent in that moment to doing that, or even for an hour, and you were supposed to already have checked it twice or whatever. I mean, that's something that, is it similar to the hospital where you just chart that and you're like, well, that was their choice?
I have to explain to them why that's not a great idea. I have to say, especially at this point in labor, when we're getting closer to baby being born, this is my one way of knowing that your baby's not getting stressed out by these contractions. So I would strongly recommend that you allow me to listen, maybe at a calmer moment, maybe when you're in a different position. But if they continue to decline that, I have the choice of saying, hey, I don't feel comfortable in this situation anymore. It's been X number of minutes or hours since I heard your baby. This doesn't feel like this is part of my scope of practice, safe for me. I'd like to recommend transport to the hospital. This has never happened, by the way.
I'm just giving hypotheticals here because I think that some people think I am glued to whatever the midwife has decided, even if it's an out of hospital birth, because at the hospital, they can't fire you. I mean, they're not allowed to be like, well, then you've got to go,
Yeah, it's true. It's a gray area. I mean, I would say most people that seek out midwifery care are in some way, shape, or form happy to accept midwifery care, happy to kind of go along with the norm, so to speak. But I do, and especially now in 2025, have tons of pushback about all sorts of things that earlier in my career, nobody was talking about. Nobody was worried about checking for group beta strep. Nobody was worried about testing for gestational diabetes. Nobody was trying to decline, getting their blood pressure checked or their baby's heart tones checked. It was just like, yeah, whatever, let's care. But I think now, because of this idea of wild pregnancies, people are feeling that less is more. And boy, that is certainly a concept that does have validity. Sometimes less is more. A lot of times people transfer care to us from OB care because they're getting an ultrasound every week because they're 35, and I'm like, I get it. I'm not really worried about ultrasound technology. I don't really think it's going to be hurting that baby or you, but I'm not a fan of duplication of care and the extra time and, the billing and everything. I'm like, yeah, let's keep it to what's needed for sure. But for me as a midwife, who's been practicing a long time, blood work, heart tones, blood pressure checks, vitals. These are all things that really help me to feel like things are going safely and normally. I can't just go off of vibes. I've definitely seen people who seem fine and are developing issues. And I use the tools of my trade to find that out.
Yeah, I think that's helpful for people to kind of hear that piece of it.
Yeah, I just want to be really clear up front. I'm not here to shame parents, criticize home birth, or wild birth, or defend obstetric violence. I'm here because I care deeply about informed consent, accountability, and what happens when vulnerable people are pulled into movements that discourage critical thinking.
Yeah, that's the huge part here, is I think being afraid and acting based on fear, but thinking that that's power. And then somebody else is taking advantage. It's like you're switching who's taking advantage of you, kind of.
Yeah,
I think
absolutely.
is what's happening a little bit here. We're just transferring who we're giving our power to.
Absolutely. So to get back into the Free Birth Society and the kind of, I'm just going to say it, cult dynamics that it developed, it started pretty open, pretty available. And what happened almost immediately with the Facebook group is that they started deleting any comments that had anything to do with negative outcomes. So, not that social media is the best place or even really a great place to make big medical decisions about your body and life, but it's certainly a place that we go for information, for free speech, for free thinking, for, crowdsourcing our decisions. I might not be making decisions about when and how I'm vaccinating my kids on Facebook, but I might go on Facebook to find a pediatrician that I like, who, other people have had good experiences with. So all that to say, their Facebook group, pretty much from the get, was pretty heavily edited, so that, you're seeing lots of comments about, oh my God, my, redemptive free birth, amazing. But then when somebody's like, hey, it was recommended to me that I stay home for 5 days in labor, and when I showed up, my baby had passed away, delete immediately.
So this heavy bias then is skewed. It's so skewed that parents aren't being able to get that balanced information and make a good, educated, informed decision for themselves. Maybe not even, I don't know what the word educated is, right? But informed decision themselves on the place that they're looking for this information. And it just looks like sunshine and rainbows.
Yeah. When you're suppressing, voices, you're not getting the full picture for sure. So that's kind of that. And also, I feel like just the kind of overwhelming positivity that you're getting from this group, and these strong voices who are talking about things that I am just going to say they did not understand. Things like retained placenta, prolonged rupture of membranes, prolonged labors, just to name a few, neonatal resuscitation, that they had very, very strong opinions about, that had nothing to do with anything other than their firsthand experiences attending births on their own. And so just to give you a few examples of, things that were talked about, we'll say, retained placentas. It was considered normal to not deliver the placenta immediately after delivery. And people, even up to a day postpartum, were told to stay home. So I can just give you an example of kind of going off of the evidence around this, what our protocols are. After the delivery, obviously, we're getting that baby skin to skin with mom. We're focusing on, making sure everybody's really comfortable and safe, that baby's breathing, that mom's in a nice, comfortable position. Because that comfort, that skin to skin, that's going to boost the oxytocin. That's going to help bring the hormones that help that uterus to do the little afterbirth contractions that help to deliver the placenta. If we have, bright lights and loud noises and everybody's running around, that's certainly going to disrupt that process. So we do everything that we can to keep it as calm as possible. If we can get baby to breast, even better, because when baby's breastfeeding, that does also boost oxytocin as well. Once we've done those things, if we are noticing that mom is not having any kind of like crampiness after birth contractions, we have herbal tinctures that we can administer. We have homeopathics. We do have meds that can help if we decide that is something that is needed based on bleeding or vitals or, kind of what we're seeing. One of the last-ditch efforts, unfortunately, if needed, is to do a catheter to empty the bladder, because if the bladder is full, that can impede the delivery of the placenta. We get mom into different positions. We might try squatting or lunging, because sometimes just moving around can help deliver the placenta. If we have hit 45 minutes after delivery and that placenta is not delivered and doesn't show any signs of being close to being delivered, that for us is an indication that mom is going to probably need help at the hospital, because what we see when a placenta, especially if it's partially detached, doesn't deliver, is that we can see catastrophic postpartum bleeding. When my clients or my prospective clients ask me, do you ever have an emergency transport? Almost by and large, the only transport that we have that is truly time sensitive is retained placenta, because you can just start dumping blood.
Can you explain why? And actually, can I have a test of myself to see if I think I know why?
Totally.
So that uterus is a muscle, and it needs to contract back down to create kind of like those living ligatures to kind of suture up the inside and get back to its smaller size so that it's not bleeding. It's not actively bleeding right in that moment. And when there is still a piece of the placenta, all or a piece of the placenta retained, it is impeding the ability to contract back down. So if there's a small piece left and there's the center of the uterus is filled with a big old placenta, it's not able to get back down to that size. Therefore, it's not able to stop bleeding.
Exactly. You nailed it.
Bam. Okay, cool. I'm teaching it right.
One of the concerns is that there is something called placenta accreta, where the placenta can actually grow into the uterine tissue. This is a very, very rare complication, but one that I've seen. And if you are just hanging out at home trying to get a placenta out that doesn't want to deliver, and it is grown into the uterine tissue and part of it detaches, you are looking for some really heavy bleeding there.
And is that more common with a VBAC as well?
Yeah, slightly.
And
slightly.
And I have found this is anecdotal, but people who had a cesarean for their first birth or however many births, and then really thought that was not medically necessary and they were coerced into, these are some of the people that are pushing away from medical assistance and going toward things like free birth because they felt like their autonomy was taken away and they don't know if they can trust any medical providers. And then, but actually, those are the times that sometimes we just need that extra set of eyes even more.
Absolutely. Yeah. And so, we're looking at people on Facebook or on their chat group giving their medical opinions. I'm just going to say medical. They wouldn't call it medical. They would call it something else, but we are talking about medicine. This is something to do with our physiology. It is not risk-free. I love pregnancy. I love birth. I love postpartum, but it is part of a body system. And as such, things can go wrong. Things can go off track. So we do need to be aware of those risks. So we're talking about people who were told to stay home with retained placentas, or told to stay home whose waters had been broken for 2, 3, 4, 5 days, whose amniotic fluid started to stink and be discolored, which is a huge red flag for infection. And as such, the demises, the babies passing away in utero or immediately postpartum, started to stack up. And, you know, it is sadly a part of the natural order that, you know, some babies will pass away while they're in utero. Some babies will pass away in labor or immediately after birth. But the statistic there, I'm just going to pull up. The statistic there for U.S. the statistic there for U.S. neonatal mortality is 3.6 per 1,000 births, and that's within the first 28 days. Going off of, a lot of the information that I pulled about the Free Birth Society is from this Guardian article that I thought was really well done. And they were able to kind of infiltrate the movement and get a ton of information and firsthand experiences of people who are in it. So they're not just like on the outside criticizing it. They were talking to people who, you know, went through the institute, people who, you know, planned their free birth with supports from radical birth keepers from the institute. And basically, in a cohort with 15 pregnant teachers and students, they had 3 full-term stillbirths, which is a 20% loss rate, all within 6 months. 48 cases reported overall. I'm not sure, you know, within how big a group that was, but I can't imagine that it was tens of thousands of people, which is, you know, it's
still much higher than the average.
It's much higher than the average. And it's couched in a way where they are talking about, let me see what it is called. They're talking about radical responsibility, which reframes death or injury as either God's will, the universe's plan, or a necessary soul lesson. Which I think removes accountability, and it also silences grief and anger and reckoning. The founders of the group offered, you could pay like, I think it was like $350 for like an hour-long breakdown, like if you wanted to like process with them after your delivery. And this French woman who had had a free birth, who had lost her baby, was trying to process with them and see if they could offer her any sort of guidance in the article. And they were, you know, it comes back 100% to like, this is your choice. You chose to do this. You have to take radical responsibility. And, you know, I do understand in some ways, like we all take radical responsibility for all of the choices that we make. But I think that when you are couching this all in a language that makes people feel like they're part of something that is safer than the alternatives and, you know, better established, better for women, better for moms, better for families, you know, when they're calling the people that they have trained midwives, albeit authentic midwives, there's a language there that I think is tricky. And, you know, I think that people who are susceptible to cults, which are anybody who is kind of either in distress, going through a transition, experiencing trauma, that, I mean, I don't want to say that's like our whole population, but I think that when
practically right,
you feel vulnerable, you feel, you know, like you are seeking out guidance. You want to find your tribe. You want to find your people. You want to have belonging. And here's this like ready-made built-in family of people who are going to just like, you know, radiate this kind of positivity towards you.
Well, and death does happen in birth. There are times where it is pretty much unavoidable. There are cord accidents. There are things that happen even to the people that get the best care you could ever imagine, evidence-based, all of these things, those things that they're calling radical responsibility, that, I mean, reframing death or injury as those things in some situations is the case. Like if there wasn't a way to help, right?
Absolutely.
And this, dare I say, and sorry if this is controversial, but like this is radical irresponsibility of the people that are guiding them this way, because people who are, I always tell people in my hypnobirthing classes, some people give birth in hospital and some give birth out of hospital. And if it's with a care provider, you don't get to give birth out of hospital if you're high risk, because they can't legally take you on. If you're in the hospital, you can be high risk or low risk. And so we don't see high risk birth out of hospital with licensed professionals because they're not allowed to. And so yes, the majority of the scary things happen in the hospital for many reasons, but one is because high risk people give birth there. Yeah. And when we are blanket statement, anybody can have a free birth, anybody, let's do it, let's empower you, and you're not being screened for the things that make you actually high risk and that are truly medical situations, then that is not radical responsibility. That is irresponsibility.
Yeah, I think that there is, and I want to phrase this so carefully, but I think that for the people who gravitate towards this movement and feel called to attend these births and get other people to birth this way, it's like almost like they have experienced trauma, and not like they are trying to re-experience trauma, but more just that they are kind of magnetized towards these life and death situations that kind of lights them up with a sense of purpose. And I understand that because my job is quite literally life or death. Not very often. Most often I'm, typing on a computer or hanging out with a mom in labor, and it's just very quiet and peaceful. But once in a while it is life and death, and that those experiences do light you up and, make you very, what does it all mean? And, kind of hits all the dopamine sensors in your brain. That said, I'm a very quiet. I'm like the sleepy time bear. I don't want to be out in these streets. I don't want to be having exciting situations if I can help it. And I think that there's a type of personality that is drawn towards the excitement of a baby born not breathing and then just letting the baby breathe versus helping the baby breathe.
Yeah, it's an attraction, and I don't mean this in a mean way, y'all, but almost like a savior complex. I so badly want to help, and I so badly, and they mean well. They really think that what they're doing is helping and having a more positive outcome and impact. And unfortunately, that's not always the case.
Yeah. Yeah. So it's tough. I really, I hold a lot of love in my heart for the moms who have, for whatever reason, come to this and, who have had these experiences and are now in a reflective state. And I really don't want them to be gaslit by the people that they were relying on for support and then excluded from other places. I want them to feel like as they move forward, as they heal from this trauma, as they look to potentially, having more babies in their future, that they don't feel like, well, I can't do this here and I can't do this here and nobody's going to accept me. I think with how obsessed we've all become with cults and how interesting cults are, I think that we can all really understand how seductive certain cults can be and how powerful their rhetoric can be, and have a lot of empathy and compassion for people who religious cults, medical cults, yoga cults. I mean, there are all kinds of cults in this world. And
that's a good point. You actually may have more open arms now than you would have 10 years ago, because the awareness of this existing and how powerful it can be and how susceptible so many people are, kind of takes a bit of that sting away, you know, when people are hearing about it, and we've not normalized isn't the right word, but just having that recognition that it exists, hopefully has made more people with open arms ready to receive you back into whatever fold you want to be in, because really these aren't exclusive spaces.
Absolutely. One other thing I want to touch on is that if you are, you know, in it and this is the right movement for you and you feel great about it, that's fine. I will say that as a midwife, and I think I would imagine for you as a doula, and I can speak for the doctors and nurses and nurse midwives that I have spoken to at the hospitals, we are becoming traumatized by dealing with people who have one foot in free birth and one foot in, you know, either birthing with a midwife or, you know, transporting to the hospital after a bad outcome. And hospitals exist as a place where we can go when we are really sick or dying. But it's really painful for me as a midwife to have somebody in my care who wants both of these things, wants a birth that is completely without any type of intervention, wants me to sit and watch them give birth, but is presenting to me as a client, as a midwifery client, as somebody who believes in science and empirical evidence and agrees to the type of care that I'm providing. Does that mean I'm trying to coerce every single client into every single thing that I have to offer? Absolutely not. I want to informed consent every single thing so that you feel comfortable with the choices that you're making and I feel comfortable with the choices that you're making. But we are coming up against, I don't want to say against, we are coming up with people who purport that they want to be in midwifery care, but who do not want midwifery care. And
this is blowing my mind because I feel the same as a doula, but totally opposite. So let me see if you think that this is similar. I have people who want to hire me because they feel like I can make such a huge impact on their birth experience. And I know that I can. After this long, I know that I can. It's not like a, you know, that, what is that word that people use? Like imposter syndrome. I'm done with that because I see it with my own eyes. But I see that I can make so much impact before the birth based on helping you know if your provider is not going to be supportive of your things. And I know that they can coerce you with the tiny little word quickly and easily, and you're going to do whatever they said. Doesn't matter if I'm your doula or not. I can't do my job as well if you have a provider who is so heavy intervention, but you want to give birth in the hospital right next to them and you love them. And so like I've stopped taking births with those clients because it makes me look like I didn't do my job very well because they sit there and they went and did everything that their doctor said, even signed up for a non-medical induction and ended up in a C-section. And sure, I helped them get skin to skin in the OR. Like, I mean, come on, I could have done so much more, right? And so it's like you want me to do my job, but you don't actually want to listen to me. I tell people all the time, you pay me for my brain, but you don't have to use it. And so similar to you, but kind of opposite is that, you know, people think that you're going to keep them safe and they want to have you there in case of emergency, but they're not letting you do the things that you would need to do to find out if there even is an emergency. So you actually can't keep them as safe. Is that the same?
It's like two sides of, or different sides of the same coin.
Yeah,
absolutely. And it's, you know, I think almost even worse for the people working at the hospital who wind up with the extreme cases coming to them. Who
I tell people all the time, you can't have a home birth in a hospital.
Yeah.
You can't do that.
Yeah. So I just want to put it out there that while this is, you know, mainly for the benefit of people who are trying to inform themselves, also as birth workers, we are being traumatized by this as well, because we do care what happens to you so much when you are pregnant. We care so deeply about your babies and your family. You know, part of why I went off to form Home Birth Honey with Meg and Brittany 5 years ago, almost 6 years ago, is that we wanted to be able to spend more time with our clients and get to know them even better. I love when I am with somebody at their birth and I know all their kids' names and their pets' names. And, it just feels so comfortable and easy. Like that is what I'm looking for. We really care. And so when I'm not able to do the things that I can do as a midwife who has been practicing for, I think, 15 years, it's really painful for me when things go wrong and, my hands were tied. I don't want to get too much farther into it than that, but I will say that, these outcomes affect us very much as well.
Yeah. I wonder, you just said something that reminded me of something and now my brain's going to do that thing that it does. It affects us. Oh, we're sitting here saying we care so much. And I just don't envy the parents that are interviewing midwives and interviewing doulas and interviewing whoever. And they don't know if you're actually one of the ones that cares so much, because we're saying it, we see it in birthing centers. We see it at homes. And, as a doula more so, because you guys at least are the midwives that are doing the good work or, really trying to care and give this informed consent. And I know that I see other midwives not do that sometimes, like depending on who it is. And I feel so bad for the parents that are sitting there trying to make that decision. And they're like, is that one of them or not? Do you have any suggestions on something that they could do or like questions that they could ask to see if that's in alignment? Or that might be a heavy question.
Great question. And I feel like we could probably do a whole episode about how to interview your doula and your midwife.
Let's do it.
But I would say a good question to ask a potential midwife is, how would you deal with me making a decision for myself that did not resonate with you and how you felt I should proceed? I mean, we can unpack that more in a future episode, but if somebody is making a decision that doesn't align with, my ideas and thoughts and experience, for the most part, that's not really a big deal. As long as I'm able to make sure that they understand the risks associated with declining something or, doing something outside of the norm. If I feel that they really understand that and they're like, okay, got it. It's not a big deal. If it's like something that could cause death or injury, it is a big deal. It's a really big deal for me. So I think that would be kind of the point there is like, do you understand that increases your risks of X, Y, and Z? Yes, fine. Or does this increase the risk of death? Let's keep unpacking it. Let's see if we can get to a consensus.
Yeah. I think this is such an important conversation to just have and for people to talk about and for us to explore and for us to look at a deeper level, because it's not surface. Like, it's not just what we see with our eyes. It is something deep within people's souls that is making them make decisions that sometimes are great for them and sometimes they're not great for them. And
I also think
that person has to live with that.
Yes. And I think that part of why I reached out and I felt that we needed to do this episode like right now is that it is to do with what's in your soul and it is to do with these bigger issues. But I think it's a microcosm of social media. And I think that, we are all as a society getting so much more information from social media than we used to. And social media is being colonized by AI and bots and bad
beautiful little algorithm that feeds into whatever we showed a minor little piece of interest in. And then we're just flooded with that and biased by it, basically.
Yes. And again, social media is a place that we can go for free speech. I mean, it's not unuseful in that capacity, but even as a sophisticated, maybe sophisticated consumer, I'm getting to the point now where I posted a cute picture of a dog. This is so stupid. And then I realized it was freaking AI. And I was like, oh my God, I'm doing that thing that the boomers do on Facebook. It was
I wouldn't even know. I thought something, humbling, because I thought something the other day. I was like, oh my gosh. And my husband's like, that is not real, babe. I'm like, oh, I didn't know.
Oh my God. And it's not even like you see the boomers posting on Facebook and it's like a crab riding on an owl or something. They're like, this is so magical. Nature's amazing. And I'm like, oh my God, grandma, stop. But, no, this was just a cute dog. And then I like went back and I was like, wait, this is a trend I'm seeing. And I was like, shit, it's AI. Oh my God, I did that. So all that to say, it is becoming more and more sophisticated, more and more difficult to differentiate between people and businesses and ideologies and cults online. So, consider spending less time, on Reddit and Facebook and Instagram and these apps that take us down the rabbit hole. God, YouTube, the very top of it all.
Hey, this is on YouTube, Leo.
Dispersing
shut your mouth.
Information. God, I forgot. I'm sorry.
I'm just kidding. I have like 12 followers or something.
Yeah, right. Yeah. But yeah, read books, talk to people who have degrees in
the work
things that you're interested in. Go to the accredited news outlets and do your best.
Yeah. Thank you so much for being willing to explore this with me. And if you are listening and you want more information from her, Homebirth Honey on Instagram and Facebook and all the things.
And I was talking smack about.
I was going to say, and she might share an AI photo, okay? And you're just going to forgive her.
Not be on purpose.
And pat her head.
Okay, Grandma.
And her cat kind of looks like it could be AI'd, but it's not. It really is that wrinkly. So thank you so much for being here. And I look forward to having you on again in the future.
My pleasure. Thank you.
All right, y'all. Circling back. We have a couple of things that we want to bring up again, because one that we want to, not a correction, but just like a specification, a change-ish, and one that we forgot to mention. We said we were going to come back to something and we didn't. So go for it, Leonora.
Okay. So I had said that I was going to circle back on Emily Saldaya and the birth outcome for her last birth, which was a quote unquote wild pregnancy and a free birth, which we don't know any other details besides what she's posted on social media, but that baby did pass away. And
prior to birth.
Yeah, I think was a demise. Yolanda Norris Clark reportedly has been pregnant, has been posting her pregnancy, I believe was due around Christmas.
For her 11th baby.
11th baby. And, as of today, it's January 9th and still don't know what's going on with that. So really hoping that everything went well.
Yeah.
Statistically, the odds are not in their favor.
And it is really interesting because even with all of this publicity surrounding all of this, and there are multiple podcasts with like a really deep dive from all of this information. This is just like very surface level what we're talking about, just to bring awareness. But a lot of these are really in-depth case studies. They're talking about everything that's happened. And the fact that, especially with Emily's last outcome, the fact that they're still on social media selling their program and their classes and all of these things is pretty wild to me. I guess that's just a personality difference. I would be like, oh my gosh, everyone, don't look at me ever again. I'm going to go away so that maybe people will forget about me if I'm not out there, But she is very still, hey, I'm here and I still believe in this. And, yeah, that's just kind of the way that it is. And there are a lot of people asking on Yolanda's page, like, hey, would love an update about the baby, but there hasn't been any updates from that end. So that was one of the things that we wanted to bring up. And then anything else about that before I go on to the next thing?
Nope, just okay. Mom brain. Poof.
Yeah. And then the other one is, I think we've been saying Emily's last name wrong. I think it's Saldaya and not Saldana. And then she had, there were people that had free births before. I listened back and I realized that the way that we said it maybe made it seem like it didn't exist before Emily. Yeah. And
I'm sure that people have been having deliveries unattended by other people since people started having babies. And I'm sure that there have been trends around that. I think that what they were able to do was take the interest in that and monetize it and create a platform for it that was extremely flourishing and viral, and make it seem like a very normal,
trendy, cool thing to do,
reasonable
almost.
thing to consider. Yeah.
I mean, Yolanda, before her and Emily ever even met, Yolanda had her own free births. So this is definitely something that was happening. And Emily already had this idea of creating this group, and, it obviously evolved way past that, but eventually brought Yolanda into the fold on that after multiple attempts of kind of getting her attention. So yes, it's that this caught like wildfire because of the spark that she created, that Emily created with this Free Birth Society. And I'll give it to her. She's quite good at business. I mean, she's done a good job of getting her podcast out there. And I think that this topic is very interesting to people. And so many of us are searching for something else because the system is very broken. And so it's a very vulnerable population. Anybody who's bringing a baby into the world is very vulnerable, and anybody trying to get pregnant is very vulnerable to any input. Like I've talked to moms that deal with infertility that are like, I would have bought whatever cream or snake oil or dipped my foot in a random pond and jumped on one foot only for the next 24 hours with my right arm raised in the air, like whatever you tell me to do.
It's very personal. It's very like, of yourself, like your ability to create life, to bring life forth, if that's, part of your life plan. And I think that you're right. I think that women who, people who are pregnant, families, starting families, it's like, it goes to the very core of you. And as such, it's hard to, I think if anything, my goal with this podcast is for people to feel empowered and to not get isolated into groups that discourage open communication and suppress information. I want people to have curiosity about midwifery care, about, finding great OBs to work with, getting that care that helps to keep you safer, but to feel empowered to absolutely not put up with abuse in the medical system, and to feel empowered to say no when you want to say no. That is really important.
Yeah, I agree. Okay, well, we cleared it up. We just wanted to add those little things. Goodbye.
Bye.
Thanks for listening. If you enjoyed today's episode, please take a moment to follow, rate, and review the podcast. It helps us reach more families who can benefit from this resource. For more resources, classes, and services, head to empoweredbeginningsatx.com or check out the Birth Baby Academy at birthbabyacademy.com. Until next time, wishing you confidence and calm on your journey through birth and beyond.